Greetings. Today I will be demonstrating the non-rebreather mask skill competency. The first thing I will do is verify my physician's order, which you can see behind me on the board. My physician's order has the date and the time, oxygen therapy via non-rebreather mask at 15 liters per minute for 24 hours. Document pulse oximetry with vital signs Q4, and this order is signed by Dr. Jones. At this point in time, I'm going to take a few moments to review my patient's chart for any significant findings related to their care. After I've finished my chart review, I'm going to verify that I have all my equipment. I have my hand sanitizer, my gloves, my non-rebreather mask, and behind the patient's bed you can see the flow meter and the Christmas tree adapter. At this point, I'm going to apply my hand sanitizer since it is permitted by my facility. If this isn't permitted at your facility, you would wash your hands. While the sanitizer dries, I would like to let you know that this patient is not in any isolation precautions, so today I will simply be observing standard precautions, which will be gloves for the purpose of this video. Now that my hand sanitizer is dry, I'm going to apply my gloves and come in and greet my patients. Good afternoon, Mr. Smith. My name is Amy. I'm the respiratory therapist, and I'll be here helping to take care of you today. So the doctor has asked us to place you on an oxygen mask to help give you some extra oxygen while you're recovering here in the hospital. Before we begin, I'd like to check your heart rate, respiratory rate, breath sounds, and obtain a pulse ox on room air. Now that I've completed my pre-assessment, I will go ahead and place the oxygen mask. I'm going to place the mask on the oxygen flow meter and turn the flow up to 15 liters per minute as stated by the physician's order. I'm going to make sure that the bag has fully inflated. Okay, Mr. Smith, I'm just going to go ahead and place the oxygen mask on you. Just going to reach that behind your head a little bit. And going to make sure that fits well across the bridge of your nose and check the bag. At this point in time, it appears the bag is staying inflated, and I do not need to make any adjustments to the oxygen flow to ensure that we're meeting the patient's needs. Now that the mask is complete, I will complete a follow-up assessment, which will include the heart rate, respiratory rate, and also a pulse ox to make sure that my patient has adequate oxygenation before I leave the room. After I'm finished with this, I will restore the room. Thank you, Mr. Smith. I appreciate your time. You have a great day. I'm going to restore everything to the condition that I found it. Then I will remove my PPE, apply my hand sanitizer. If not permitted at my hospital, I would wash my hands. Once my sanitizer has dried, I will go ahead and document the procedure based on my hospital's policy. This now concludes the non-rebreather mask skill competency.